AI serves as an enabler for how myeloma patients navigate their journey. And
Yeah.
it is not necessarily replacing the human connection, but really strengthening it by allowing patients to make a more personalized, accessible, and effective decisions.
Welcome to another episode of Data Strategy Unraveled. I'm your host, Kendra Reed, Principal Data and Gen AI Strategy Specialist here at AWS. Now, if you've been watching our videos for a little while now, we had one a few weeks ago on healthcare and the role that data and AI is playing in that industry. Now, in that video, we talked a little bit about Omada Health and some of the things that they're doing in that space when it comes to data analytics. But we really wanted to double click into that healthcare space and bring in another customer testimonial and how AWS has partnered with them in order to improve those patient outcomes for their patients. And to talk about this, we have the CEO of the International Myeloma Foundation, IMF, Yelik Baru. Hey, Yelik, how you doing?
Thank you so much for having me.
Yeah, we're happy to have you here. We're really grateful for you to join us today. How about you tell us a little bit about yourself, maybe where you're joining us from, before we get into some of these questions we have?
Absolutely. My name is Yalak Baru. I have the pleasure of serving as president and CEO of the International Myeloma Foundation. When you said IMF, what came to my mind was Impossible Mission Force. But sometimes the work
Yeah,
we do sounds like an impossible mission. It
yeah.
is a nonprofit organization that has been in existence for 35 years. This coming October, actually, we'll celebrate our 35 year. But this organization is near and dear to me because I'm also a multiple myeloma patient
Hmm.
diagnosed at age 25, almost 30 years ago, and was told that I only will be able to live 2 or 3 years. And I for sure will be dead before I turn 30. So I'm happy to join you really in this, my 30th anniversary of living with multiple myeloma.
Wow. Wow. Yeah, we're happy to have you. And I'm sure some of our viewers here probably didn't think you were older than 30 the way you look today, right? Um,
Right, right.
so, the reason that we have you here is to kind of talk about, you being the CEO, you partnered with AWS, specifically our data strategy team, and your vision that you have for data and AI and how it can help your organization. So let's kind of jump into this. And so let's lay out what is your vision when it comes to data, AI, maybe even generative AI now in patient care when it comes to myeloma.
As a myeloma patient who, as just mentioned, has lived almost 30 years with this disease, and I call myself also a recovering computer scientist and data analyst because I worked in the for-profit world for almost 25 years. This is personal to me, right? I have experienced firsthand the complexities of having to navigate treatment decision, understanding new therapies, and really navigating complex landscapes of healthcare here in the US. So when you ask me about my vision for data AI and Gen AI as a myeloma patient, it really is to be able to transform how patients access, how patients understand, and how patients act on critical health information, ultimately with the goal of improving outcome and quality of life for myeloma patients. If you allow me, I want to explain it in
Hmm.
3 or 4 different areas. The first one is around learning prescription. All of us have different ways of consuming information, different levels of technical understanding and health literacy, and being able to create a learning prescription using AI systems can really support patients make informed choices. The second one is diseases like multiple myeloma, cancers incurable, affect different populations differently. Different people with different socioeconomic situations, they are impacted by myeloma, and the outcomes are different. So I really want to use AI, data analytics, and Gen AI to provide equitable access to information So patients are able to navigate a culturally relevant, language adaptive, and literacy conscious resources as they navigate their myeloma care. In multiple myeloma, like other diseases also, shared decision making is really important.
Yeah.
Being able to be the person at the table when your doctor, when your healthcare professional is making the decision for what your next best treatment should be.
Hmm.
So myeloma patients can leverage AI and Gen AI types of tools in order to enhance their shared decision making. So I think really, if I want to summarize this, is AI serves as an enabler for how myeloma patients and patients navigate their journey. And
Yeah.
it is not necessarily replacing the human connection, but really strengthening it by making allowing patients to make a more personalized, accessible, and effective decisions.
Yeah, I mean, really, what you laid out there is a lot of what we've talked about on this channel, how the technology is really an enabler for the value that you want to provide. A lot of times we're talking about business value, but here you're talking about that patient value that you're providing using technology. So yeah, that's really great there. And I know that our team, the data strategy team, partnered with you and your team, patients and caregivers on, our D2E design thinking process and helping you to really sort of envision how that data and AI can really sort of create that better patient experience for your patients. Um, how has that, we went through that process, that data strategy process, I guess you could say, how has that benefited a lot of what you're talking about here when it comes to the initiatives that you had with IMF?
Yeah, maybe a little over 2 years ago, we were really able and fortunate enough to benefit from yours, Tanya's, Kelly's, and many other D2E leaders within AWS's knowledge, experience, and also technical abilities. So for me, D2E, the data-driven everything methodology, is really a very powerful framework that, as you mentioned earlier, helps us align the business and the technical priorities.
Hmm.
As you mentioned, technology is not for the sake of technology unless you are AWS or some other tech company.
Yeah,
But if you are a small business and nonprofit like us, we really need to use technology to help accelerate the business. So I think that the biggest benefit for us of the D2E methodology was really identifying clear problems
hmm,
and setting measurable objectives and defining the benefits of data-driven solutions.
yeah,
So we knew what we can do with technology, but we didn't necessarily have that clear definition of what the problems that we're trying to solve was
yeah,
and what was our measurable objective and how we achieve that.
yeah,
I think the other benefit of the D2E methodology and the team that AWS was able to assemble is really it allowed us to bring all of the key stakeholders from our side. We brought patients, we brought care partners, we brought clinicians and key opinion leaders in the field of multiple myeloma, we brought nurses, we brought IMF team members and as other decision makers, and it allowed us really to co-create the solution, agree on the problem, prioritize the outcomes, and be able to co-create the solutions as during that 2 or 3 days. But there was a lot of pre-work and there was a lot of post-work that was done. So for me, really creating problems, I'm sorry, understanding the problems,
hmm,
but also creating the solutions that are very near and dear to the myeloma patients and the myeloma community was really key.
yeah. And what you mentioned about bringing together those different personas, before I actually joined the team, et cetera, I learned about this methodology, I thought it was so fascinating, right? Being able to understand what these different personas are, how they see the data, how they're interacting with data, the challenges that they might have, right? It really helps you uh, understand what they go through in their day to day and how to help solve for that and understand what is the overall challenge that we want to solve to help benefit these different personas with that overall solution we're driving here. And so I know that.
It also can drive.
Uh-huh.
So what it also allowed us was bring all those stakeholders
Yeah.
and say, who should we be creating these tech solutions
Is that?
for?
Yeah.
So it allowed us to specifically identify three key personas that we wanted to create this, what we are calling the Myeloma Knowledge Platform, which is really a personalized data-driven guidance methodology for myeloma patients. So
Mm.
we had newly diagnosed multiple myeloma patients that we identified as a persona. We also at the IMF wanted to become data-driven, and we identified ourselves as one of the personas we want to have this solution for. But the third persona that we created was the community physicians. Community physicians are where 70 plus percent of the myeloma patients get diagnosed, get treated, and get all their care for multiple myeloma. But those physicians also treat 10, 12, 15 different types of other cancers. And the landscape of multiple myeloma is exponentially and significantly becoming more complex
Hmm.
with the discovery of new drugs and the bringing to market of new therapies. So we really also need to make sure that our solution was going to be able and help to transform myeloma care for myeloma patients wherever they were receiving care.
Yeah. And so you mentioned there a little bit about the platform that you all built coming out of that workshop. So let's talk a little bit about that. I think there was a chatbot component there too to help augment some of the services of the IMF support team. Can you talk a little bit
Yeah.
about that and kind of where you all are now since you've gone through that process?
Absolutely. So the thing I call it the thing we came up with
Yeah.
when worked through D2E with AWS is the Myeloma Knowledge Platform. It is really allowing us to bring all of the patient experiences with us, like in an omni-channel way. So the way we approach this is AWS knows about their customers very well when you go to Amazon and you are able to purchase you want to purchase something. Why can't we do the same thing for myeloma patients? We want to know when they attended a myeloma seminar. We want to know what they consumed on our website. We want to know the questions they asked our info line. Not because we want to be creepy, but because we really want to be able to understand and provide learnings to the next myeloma patient that looks like them and
Yeah.
is traveling their experience.
Yeah.
So the manifestation of that was creating of a data lake, what we are calling MKP, Myeloma Knowledge Platform, but on top of that, putting a Gen AI platform on top of it called Milo. Milo is really a personalized assistant like Alexa for myeloma patients that is able to engage them and understand the questions that they are asking and be able to provide the answers in terms that they are able to understand. Since our launch of Milo in January, I think it actually was January 12th, we have had over 20,000 interactions from Milo, and the
Wow.
success story is really outstanding.
Yeah.
Yesterday, we spoke someone from the Middle East, and they say they have family members, but they are very alone in their myeloma journey, so they really interact with Milo.
Mm.
We interacted with somebody here from the Los Angeles area that has recently lost their spouse, but they progressed from the early precursor condition of multiple myeloma to full-blown myeloma, and they were able really to interact with Milo, and Milo was able to answer their question. Really, the most transformational, or I think the most insightful evidence of how Milo is helping patients is there is a patient and his care partner that are very, very knowledgeable about myeloma. They're actually like a super advocate.
Hmm.
But they said one night on a Friday, they got a response from one of their test results they were receiving on MyChart. and they were worried that they had relapsed or the patient had relapsed.
Mhm.
They went to Milo, they cut and pasted that question and the result, and Milo assured them that they have not relapsed and explained what that test result meant and gave them really the peace of mind they needed over that weekend until they met their with their doctor on Monday. So we are leveraging the success of Milo
Yeah.
now to ideate and create Milo MD. As
Mhm.
I mentioned earlier, 60 to 70% of myeloma patients are diagnosed and get treated in the community hospitals.
Mhm.
So, and this oncologists treat a lot of other myeloma patients. So the premise behind Milo MD is it will be able to be fed the information about the patient that's sitting in front of the physician and allow them to be able to understand what the next best treatment option for the patient that's sitting in front of them is. So really leveraging data,
Yeah.
leveraging artificial intelligence, it really is enabling both patients and clinicians to make a very informed decision in their treatment and treatment guidance.
Yeah, I mean, you all are really transforming not just the myeloma space, but really healthcare in general, I think, right? In the capabilities that you're providing, right? Because what you're doing here could easily be provided in other areas as well. Um, and you know, we have some viewers most likely that probably have the same vision as you when it comes to being able to leverage data and AI for, I guess you could say, for good, right? They see that vast opportunity when it comes to the tech and data and want to be able to share that and bring others along with them on that vision. Can you share any learnings or guidance for these other organizations or leaders that aspire to be kind of where you all are now?
Absolutely. And as you said, a lot of other nonprofit organizations have reached out to us saying, how do we get started?
Yeah.
I think that the key is really understanding what we talked about at the beginning of this podcast. It is not about the technology itself. It really is about the problem you are trying to solve.
Hmm.
So being crystal clear about what is the problem that you are trying to solve, start by really understanding the needs of the people we serve, whether it is in the healthcare area or homelessness or whatever it may be. In our case, it was about patients, caregivers, and the doctors that treat them. So that is really one. The second portion for us was really fostering an overall data-driven culture. We have to pay, and we are still paying our tech debt. I don't think we, as an organization, we really understood the challenges with bad data or dirty data or classified how you may want to classify it.
Yeah.
So us really truly peeling back the onion, going back to the source of the data and ensuring that the data that's feeding the myeloma knowledge platform in our data lake is clean was really important. And in general, also us saying this is how we have done it to us saying that this is now what the data is telling us
Mm.
is a transformation that we are still undergoing. And
Yeah.
I believe a lot of other organizations really need to undergo as well.
Yeah.
I think the other element is the human element. We briefly touched on how data or technology is not going to replace the human. Uh, there is fear within the organization that we have to alleviate that we are not bringing this technology to replace any humans. We're bringing this technology to really enable the humans that are supporting the patients.
Yeah.
So patients in some cases can become self-servant in some areas and allow our team members to be able to address the most complex questions that our patients have. So Milo and our chatbot in general and our mindset shift towards this data-driven approach has really been transformational. And the
Yeah.
last element I'll bring here is don't really underestimate the power of collaboration.
Mm.
I, for example, never thought we'll collaborate with an organization like AWS. or some of our other collaborators today that have allowed us to bring Milo to life and allowing us to really sustain and think through what the next transformation of Milo MD or what the next transformation of this AI enabled, technology enabled journey for myeloma patients would be.
Yeah. I think that's an interesting point that you mentioned there, because I think a lot of companies struggle with the collaboration internally with these siloed teams. But what you're saying here is, companies collaborate with other organizations, right, to take the learnings from one another and collaborate together to build those outcomes that they both are envisioning. Can be really powerful, just as you all have done as well. Yolet, thank you so much for taking the time to join the channel today and provide these gems that you've given us, especially our viewers. I'm sure a lot of them found it insightful and inspirational. I know I have. And we hope to maybe have you back in the future when you continue to build out this platform. You can talk through some of the things that you've done so far. All
Thank
right.
you so much. Thank you
All
for
right.
having me.
Thank you.